forward to help all Canadians. We recognize that. We continue to be there for you. You don't have to face this alone. We will support you and your families as you keep us all safe. Thank you for what you're doing. And to all Canadians, I know you're exhausted. I know you're all sick and tired of COVID-19. I know nobody wants to be in this third wave. Nobody wants to be facing further restrictions. We just want to be done with this. But we know how to do what we need to do. We need to follow the public health rules. We need to hang in there and hunker down for a number of more weeks. Nobody wants to do this. I got in an argument with my 13-year-old this morning who doesn't want to do this. Nobody wants to do this. But we know that if we hang in there, hunker down, and follow the rules for the coming weeks, as much as we're tired of them, as much as we're frustrated, we have a chance of getting to the summer in much better shape. This is a moment for us to dig deep at what is hopefully the very late stages of this pandemic for us all and make it through. It's time to show our neighbors and our loved ones what we're all made of as we keep people safe. La semaine passée, j'ai répété au Premier ministre des provinces et territoires qu'on est prêt à leur offrir tout le soutien nécessaire. On traverse actuellement une période très grave de cette crise. C'est important qu'on continue de travailler en équipe parce qu'ensemble, on va passer à travers. On vaccines, while we, like many other countries, have been impacted by manufacturing challenges at Moderna's European facility, this morning I have some very good news to share about Pfizer. Canada has now signed an agreement with Pfizer for 8 million more doses of the vaccine. This is on top of what we have already purchased. I want to thank everyone at Pfizer for their cooperation and hard work, not just to keep deliveries on schedule, but to move more doses up and reach new agreements. With the new deal, Canada will receive 4 million additional Pfizer doses in May, another 2 million in June, and 2 million more in July. For next month alone, this will come out to about double the Pfizer doses we were originally expecting. All told, we'll be receiving 8 million doses in May and almost 12 million in June from Pfizer alone. Now that's a lot of numbers, so here's the bottom line. More doses arriving sooner means more people getting their vaccines faster. And that means more people who are safer and more families that can breathe a sigh of relief. Le Canada a maintenant conclu une entente avec Pfizer pour obtenir 8 millions de doses supplémentaires qui s'ajoutent à celles que nous avions déjà achetées. Grâce à cette entente, on va recevoir 4 millions de doses supplémentaires au mois de mai, 2 millions de doses supplémentaires en juin et 2 millions de doses supplémentaires en juillet. En résumé, ça veut dire qu'on va recevoir environ 2 fois plus de doses de vaccin Pfizer que prévu pour le mois de mai et des millions de plus en juin. On travaille sans relâche pour que chaque Canadien puisse se faire vacciner le plus tôt possible. Je sais que bien des gens, particulièrement des jeunes, attendent patiemment leur tour pour que leurs grands-parents, leurs parents et les travailleurs de première ligne puissent se faire vacciner en premier. Merci et tenez bon. Vous allez recevoir vos doses bientôt. On est en bonne voie pour vacciner complètement tous ceux qui le souhaitent d'ici la fin septembre. Je sais que ce printemps a été difficile, mais l'été et l'automne seront meilleurs si on tient bon et surtout si on suit les règles de la santé publique. Remember that this won't last forever. There's every reason to believe that we're now in the final, although toughest, stretch of this pandemic. This is not the moment to let up, not even for a second. So no matter where you live, keep your distance, wear a mask, stay home whenever possible. wash your hands, download and use the COVID Alert app, and be sure to follow local public health guidelines. Hang in there a little longer because we're going to get through this. C'est tout à fait normal de ressentir de l'anxiété ou du stress en ce moment. Vous n'êtes pas seul. Votre santé mentale est importante et il y a des gens qui peuvent vous aider. Si vous éprouvez des difficultés, n'hésitez pas à demander de l'aide. Il y a 1 an, on a lancé le portail en ligne Espace Mieux-être Canada. Le site Web offre un soutien gratuit et confidentiel en matière de santé mentale et de consommation de substances, 24 heures sur 24, 7 jours sur 7. En 1 an, plus de 1,2 million de personnes d'un bout à l'autre du pays ont utilisé cette ressource. Il n'y a pas de honte à avoir besoin de parler à quelqu'un ou de demander de l'aide. Alors que vous soyez à la recherche de conseils, de ressources, de renseignements fiables ou d'un soutien immédiat, vous pouvez toujours vous rendre sur le site de l'Espace Mieux-être Canada pour trouver de l'aide. Whether on vaccines, healthcare resources, or mental health support, we're focused on what you and your family need to get through this crisis. On that note, this Monday, we will be releasing our 2021 federal budget. In the last few days, I've had meetings with all of the party leaders to discuss that budget. As I said to each of them, it's vital that we work together right now. This is especially true on measures that are about helping you get through this pandemic, whether you're a parent, a student, a small business owner, or a senior. On aura plus de renseignements à vous fournir lundi prochain au sujet du plan qu'on met en œuvre pour assurer la sécurité des Canadiens, créer des emplois pour la classe moyenne et rebâtir une économie propre et résiliente. Mais pour l'instant, je veux simplement vous dire ceci. L'ensemble des mesures prévues dans ce budget ont pour but principal de vous aider à traverser cette crise et de rebâtir un Canada plus fort pour tous. Finally, I just spoke with Her Majesty the Queen to extend my deepest condolences and the condolences of all Canadians on the passing of His Royal Highness the Duke of Edinburgh. She expressed to me how touched she was by the tributes that have been flowing in from Canada and around the world for Prince Philip. And she highlighted and remembered for me all the fond memories she holds of trips to Canada with him over the past many decades. Prince Philip's legacy of service will be long remembered here in Canada, especially in his work to empower young people. Merci tout le monde. Thank you. I'll pass it now to Minister Anand. Anita.
Thank you, Prime Minister. Good morning, and thank you all for joining us today. I will take just a few moments to expand on the additional Pfizer deliveries that are coming to Canada in May and June, as well as provide some other vaccine updates and how they fit into the overall vaccination campaign. À ce jour, plus de 12 millions de doses ont été livrées au Canada et nous collaborons activement avec nos fournisseurs pour accélérer et renforcer les calendriers de livraison. Ce travail porte fruit. Par exemple, au départ, nous devions recevoir 6 millions de doses de vaccins avant le fin de mars. Nous avons dépassé cet objectif de 3,5 millions de doses et en avons reçu 9,5 millions. As the Prime Minister has just announced as well, this week we have secured an additional 8 million Pfizer vaccine doses under our agreement. The first 4 million additional doses are scheduled to arrive in May, followed by 2 million doses in June and 2 million more doses in July. In addition to this, Pfizer is also moving another 400,000 doses from the third quarter into the month of June. Thus, the delivery schedule for both May and June will see approximately 2 million doses of Pfizer coming into the country every week, and indeed in June, that amount will be more. There will be 12 million doses spread over the 5 weeks in June. The total is going to be 24 million doses between April and June from Pfizer alone. That is excellent news. C'est une excellente nouvelle pour la population canadienne. Cela veut dire que nous allons recevoir plutôt plus de doses de vaccins du Pfizer et ce en plus des millions de doses des autres vaccins que nous attendons déjà. Comme je l'ai souvent indiqué au sujet de l'équipement de protection individuelle et aujourd'hui des vaccins, le marché mondial demeure très compétitif et volatile. In this vein, as Moderna indicated this morning, it faces ongoing challenges with ramping up production to meet intense global demand due to labor shortages and other issues. As a result, our next shipment will be smaller than expected, and we may see additional delays over the coming months as Moderna's production capacity continues to increase. This news is obviously very disappointing. Our government will, however, continue to bring vaccines into the country in the face of volatile supply chains. Remember that a year ago, vaccines didn't exist for COVID-19. Supply chains and manufacturing systems did not exist either. We will continue to press Moderna and all of our other suppliers to do everything possible to respect their delivery targets and to provide more consistent delivery schedules. I can now also provide an update on anticipated deliveries of Johnson & Johnson's vaccine and AstraZeneca. Canada will receive an initial shipment of approximately 300,000 doses during the week of April 27th to be delivered to the provinces at the beginning of May, with more substantial deliveries coming in the latter part of this quarter and into the summer. For AstraZeneca, Canada is still expected to receive 4.1 million doses from all sources by the end of June, with further deliveries in the third quarter. Indeed, I spoke with AstraZeneca executives this morning and am pressing for more AstraZeneca doses to Canada in the coming weeks and months ahead. In total, Canada will receive between 48 to 50 million doses of vaccine by the end of June. Despite the temporary and short-term fluctuations in deliveries from our suppliers, Canada's vaccination campaign overall is gaining ground. We are currently ranked fourth among G20 countries for doses administered per capita, and second in the G20 when it comes to the average number of doses administered daily per capita. Cela dit, ne vous méprenez pas. Malgré tout ce progrès, il reste encore beaucoup de travail à faire et notre gouvernement entend bien veiller à ce qu'il soit fait. Les prochains mois seront déterminants. Tous les Canadiens et Canadiennes doivent faire leur part et continuer de suivre rigoureusement les consignes de la santé publique pendant que la vaccination suit son cours dans tout le pays. Our government will do its part by continuing to support Canadians in our time of need. And I can tell you that my team and I will do whatever it takes to ensure that an accelerated flow of vaccines will keep coming into this country. At the end of the day, I'm a mom with a spouse and 4 kids and 3 dogs. I feel the urgency, like everyone else, to get vaccines to Canada as soon as possible. Every day, my team and I are ensuring that our delivery of vaccines increases for the benefit of all Canadians. Merci beaucoup. Thank you. Miigwech. Dr. Tam?
Bonjour. Bonjour. Hello. Good afternoon and bonjour à toutes et à tous. So to date, over 1,096,000 cases of COVID-19, including 23,500 deaths have been reported in Canada. Over the past week, there have been an average of over 8,600 new cases reported daily. During the same time, the number of people experiencing severe and critical illness continues to rise. On average, over 3,400 people with COVID-19 were being treated in our hospitals each day, including almost 1,500 people being treated in intensive care units, representing a 34% and a 22% increase, respectively, compared to the prior week. Unfortunately, we're now beginning to see an increase in the mortality trend, with an average of 41 deaths reported daily over the past week, which is a 38% higher than the week prior. There are over 51,600 variants of concern cases reported to date across Canada, with the B117 variant accounting for almost 96% of these. On this final or last stretch through this crisis, we can also gain strength from good news and focusing on the things we're grateful for. We have been heartened by the many ways Canadians are helping to support COVID-19 vaccination efforts. Since April is the Sikh Heritage Month, we'd like to highlight an example we recently learned about from that community. Sukhmeet Sachar, a UBC, University of British Columbia, medical student, has been working together with the Sikh Health Foundation and a team of volunteers to translate and share information about COVID-19 with Punjabi-speaking seniors in the Fraser Health region. Their efforts are helping to support community members to make an informed decision on vaccination and at the same time dispelling misinformation. This week, we were also grateful to be among the over 7 million people in Canada who have received a first dose of COVID-19 vaccine to date. And the good news is that vaccines are reducing severe illness, deaths, and outbreaks in high-risk settings and populations that were targeted in our initial phase of vaccinations. Though we all need to keep following public health advice and maintaining our well-practiced precautions as vaccines roll out further, these benefits are building, and they will be the bridge that takes us all to greater safety and back to the things we have missed so much. Thank you.
Bonjour à toutes et à tous. À ce jour, plus de 1,096 000 cas de COVID-19, dont 23 500 décès, ont été recensés au Canada. Au cours de la dernière semaine, en moyenne, plus de 8 600 nouveaux cas en moyenne ont été signalés chaque jour. Au cours de la même période, le nombre de cas graves et critiques de la maladie continue d'augmenter. En moyenne, plus de 3 400 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, dont presque 1050 personnes étaient traitées dans des unités de soins intensifs, ce qui correspond à des augmentations de 34% et de 22% respectivement par rapport à la semaine dernière. Malheureusement, nous commençons à observer une augmentation du nombre de décès. La moyenne se chiffrant à 41 décès au cours de la dernière semaine, soit 38% de plus que la semaine précédente. Nous enregistrons plus de 51 600 cas de variants préoccupants à ce jour au Canada, le variant B117 représentant presque 96% des cas. Durant ces derniers efforts vers l'issue de la crise, il est possible de retrouver des forces en apprenant de bonnes nouvelles et en nous attardant aux choses qui suscitent chez nous un sentiment de reconnaissance. Nous avons été ravis de voir de nombreuses façons dont les Canadiens appuient les efforts de vaccination contre la COVID-19. Puisque le mois d'avril est le mois de patrimoine sikh, nous aimerions souligner un exemple dans cette communauté qui a récemment été porté à notre attention. Sukhmeet Sachar, un étudiant en médecine de l'Université de la Colombie-Britannique, collabore avec la Sikh Health Foundation et une équipe de bénévoles pour traduire les renseignements sur la COVID-19 et les diffuser aux aînés qui parlent punjabi dans la région sanitaire du Fraser. Ce travail permet d'aider les membres de la communauté à prendre des décisions éclairées au sujet de la vaccination tout en empêchant les mésinformations. Cette semaine, nous sommes aussi reconnaissants de faire partie des 7 millions de personnes au Canada qui ont reçu à ce jour la première dose de vaccin contre la COVID-19. Or, la bonne nouvelle, c'est que les vaccins permettent de réduire le nombre de cas graves de la maladie, de décès et d'éclosions dans les milieux et les populations à risque élevé qui avaient été ciblés durant la première campagne de vaccination. Mais pourtant, nous devons tous continuer à suivre les conseils de santé publique et à appliquer les mesures de précaution bien ancrées dans nos habitudes, tandis que nous continuons de procéder à la vaccination. Les vaccins continuent de faire effet et ceux-ci permettront d'atteindre le moment où nous serons en sécurité et nous pourrons à nouveau profiter des choses qui nous ont tant manqué. Merci.
Merci, Dr. New. On va maintenant passer à la période des questions en commençant par le téléphone avec une question suivie. We'll then go to the room. Please note that Minister Anand and Dr. Tam will have to leave at 12:30. Opérateur, c'est à vous.
Thank you, merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur l'étoile 1 maintenant pour poser une question. The first question is from Marika Walsh of the Globe and Mail. Please go ahead. Your line is open.
Good morning. Thanks so much for taking our questions. Prime Minister, my question is for you. The Canadian Medical Association is calling on the federal government to change its vaccine allocation and to now start allocating vaccines based on needs in region and not based on per capita. Will your government do that?
Thank you, Marika. These have been conversations we've had ongoing with the provinces over the past many months. Working with the provinces, we arrived at a per capita allocation formula with a carve-out for the northern territories to make sure that they could get rapidly vaccinated because of the level of vulnerability. But of course, we're happy to continue to work with the provinces on adjustings as the provinces see necessary. Depuis les débuts, nous avions travaillé avec les provinces et territoires pour assurer une allocation équitable de vaccins à travers le pays, avec une exception faite pour plus de vaccins pour le Grand Nord où il y a particulièrement de vulnérabilité. Mais évidemment, nous sommes toujours ouverts avec des discussions avec les provinces pour modifier les allocations si ça leur intéresse.
Thank you. So should I take from that you do not personally support changing the current allocation method from per capita? And my next question is on the request from Ontario for 600 critical care staff. Does Canada have that slack in the system that it can send Ontario 600 critical care staff? And if not, are we talking to the U.S.?
We are extremely preoccupied with the situation right now in Ontario, and as I told mayors last night, as I've told my members of Ontario Caucus, and as officials have been engaged back and forth with the Ontario government, we are there to help. We look forward to delivering any and all supports that they need. Those conversations are extremely live right now and ongoing. I know there's also been discussions about healthcare resources from other provinces turning towards Ontario. These are all the things that we're working very, very hard on right now to respond to the extremely difficult situation in Ontario. Les conversations continuent, évidemment. Nous sommes très, très préoccupés avec la situation en Ontario et ailleurs au pays, mais particulièrement les conversations que j'ai eues avec nos députés de l'Ontario, avec différents maires et les conversations qui sont constantes entre mon bureau et le bureau du premier ministre Ford. Nous allons être là pour aider. On est en train de travailler sur exactement c'est quoi l'aide dont ils ont besoin. Mais je peux aussi souligner qu'il y a des discussions avec les autres provinces aussi pour allouer plus de ressources pour aider dans cette crise particulièrement urgente en Ontario.
Merci. Next question.
Thank you, merci. La question suivante est de Mélanie Marquis de La Presse. La parole est à vous.
Merci. Bonjour, M. Trudeau. Je comprends qu'on reçoit les 300 000 premières doses de Johnson & Johnson le 27 avril, selon ce que votre ministre disait. Dans quelle mesure est-ce que le fait que le vaccin est suspendu temporairement aux États-Unis change la stratégie sur le plan de l'approvisionnement? Est-ce qu'on en tient compte ou pas du tout?
On continue de s'attendre à recevoir ces doses aux fins du mois d'avril et les autres doses par la suite. En même temps, évidemment, on va suivre attentivement tous les conseils de Santé Canada par rapport à ces doses-là. On va toujours se fier sur les recommandations des experts par rapport à la sécurité et la santé des Canadiens. Mais peut-être que je peux passer la parole à la ministre Anand, qui en a peut-être à ajouter.
Oui, merci beaucoup, Monsieur le Premier ministre. Oui, nous travaillons très fort avec le fournisseur maintenant pour apporter les doses de J&J ici au Canada, et ça, c'est notre priorité. Au même temps, nous suivons l'information de Santé Canada, et à ce moment-là, la priorité pour notre gouvernement est d'avoir plus de doses plus vite ici au Canada. Merci.
We are focused on receiving as many vaccines as possible, as quickly as possible in this country. We're expecting a delivery of the J&J vaccine at the end of April. Of course, before those vaccines are distributed, we will ensure that Health Canada is continuing to approve this Janssen vaccine for use safely in Canada. We will always put the health of Canadians first and foremost.
En suivi, Mélanie?
Oui, sur un autre sujet complètement, il y a les conservateurs hier qui ont annoncé leur plan climat. Il y a une tarification carbone. Croyez-vous maintenant, en prévision de la prochaine campagne, avoir un adversaire qui prend les changements climatiques au sérieux? Puis je sais que le plan est vaste, mais pouvez-vous me dire ce que vous pensez précisément de ce que le Parti libéral appelle les pétropoints, donc l'espèce de carte carbone que les conservateurs proposent?
D'abord, les gens attendent depuis longtemps que le Parti conservateur prenne au sérieux les changements climatiques. Malheureusement, ils vont devoir attendre encore longtemps parce que ce qu'ils ont présenté hier, c'est pas un plan. Tout d'abord, ça va rendre ça moins cher de polluer. Ça va amener plus de coûts aux familles et ça ne va pas réduire nos émissions au niveau dont on a besoin. Nous, ça fait 5 ans qu'on prend les changements climatiques au sérieux. Nous allons continuer d'être ambitieux, mais nous allons aussi continuer d'assurer qu'on aide les familles à pouvoir avancer dans un monde qui a besoin de moins en moins d'émissions de carbone. Nous, on a un plan sérieux. Ce que les conservateurs ont mis de l'avant, c'est pas sérieux. Ça encourage les gens de dépenser plus pour les carburants fossiles et leur donne des récompenses pour ça. Canadians have been waiting a long party take seriously the fight against climate change. And unfortunately, with what they put forward yesterday, Canadians are going to still wait a long time to see the Conservative Party get serious about climate change. The plan, the approach, the pamphlet, not the plan, that they put forward yesterday actually makes it less expensive to pollute, makes it more expensive for Canadians, and will not fight climate change and reduce emissions nearly enough. With Erin O'Toole's carbon tax, the more you burn, the more you earn. That doesn't make sense to anyone. We're going to stay focused on a real plan that not only is ambitious and stringent against carbon emissions, but supports businesses and families by returning more money to average families across the country, and indeed creates jobs and economic opportunities as we know the world is moving in that direction.
Last question over the phone.
Thank you. Merci. La prochaine question, the next question is from Ryan Tumulty of the National Post. Please go ahead.
Yeah, hi there. Moderna's news that they are cutting their shipment and that they might miss their quarterly target. I know previously they had said that it was a quality control issue. Now they are saying that there's a bit of a supply problem. I'm wondering if your level of trust in this company's ability to deliver is shaky at all.
We have been extremely well served by Pfizer that has been delivering every week 1 million doses of vaccines, and we are seeing that double next month with millions and millions more in the month of June. So that is reliable and will consist of the bulk of the vaccinations that we're going to be giving to Canadians in the coming months. We are concerned about the delays and the production challenges around Moderna, but perhaps I can turn to Minister Anand to speak more directly on Moderna.
Okay, well, thanks, Prime Minister. I think we should go back to our diversified portfolio of vaccines, and we have seen that various suppliers have ramped up at different paces. And Pfizer, as the Prime Minister mentioned, is very reliable in terms of the supply that we are receiving. Moderna is still ramping up, and that is the reason for the reduction in the next shipment, for example. But I do want to emphasize that Moderna did meet its first quarter targets, and it is still possible that we will be on track for our second quarter deliveries. Having said that, we are going to press Moderna going forward to make sure that Canada's voice is known and heard, that we very much expect them to meet their quarterly delivery targets. We appreciate the difficulties that the company is experiencing, but again, from our government standpoint, we are still seeking to ensure that the quarterly deliveries are there, just as we did in the first quarter of this year. Thank you.
Okay. Nous nous attendons à ce que Moderna atteigne ses objectifs et ses promesses pour les livraisons de vaccins au deuxième trimestre, comme ils l'ont fait pour le premier trimestre. On reconnaît à quel point ils font face à des difficultés de production. On est chanceux d'avoir un portfolio diversifié qui nous permet de compter, par exemple, sur Pfizer, qui est en train d'augmenter ses livraisons de façon significative. Mais nous allons continuer de travailler avec Moderna pour assurer qu'on reçoive le plus de doses le plus rapidement possible.
Follow-up, Ryan?
Yeah, sir, I'm just wondering, too, now that you have these additional Pfizer doses committed, it would seem that you might be able to move up your target of vaccinating everyone by September. I'm wondering if you think that's possible, if you think Canadians will be vaccinated earlier than that. Also wondering if you're going to try to do more about vaccine hesitancy now. Certainly, we've seen a lot of that with AstraZeneca, and now that we have a more robust supply, I think that might become more of an issue.
As we pointed out today, we're well on track to reaching in the upper 40 to 50 million doses by the end of June. That means, on the math of it, many or most Canadians will have been able to receive a first dose of the vaccination. That, of course, depends very much on provincial decisions on pacing and on target populations. We know there are a number of Canadians who will get 2 doses, but many others will have gotten their 1 dose by the end of June. That is part of the strategy and the recommendations laid out by our National Advisory Council on Immunization. We're going to continue to try and accelerate doses to Canada, but the one thing we have been firm on and are able to reassure everyone on is that all Canadians who want a vaccine will be able to be vaccinated by the end of September.
Merci. On va maintenant passer aux questions dans la salle.
Oui, bonjour, M. Trudeau, Louis Blouin de Radio-Canada. J'aimerais vous poser une question plus spécifique sur la demande de l'Association médicale canadienne. Tantôt, vous avez dit que vous êtes ouvert à voir pour une réallocation des vaccins en fonction des points chauds, mais pouvez-vous me dire spécifiquement où en sont les discussions avec les provinces? Est-ce que vous sentez une ouverture des provinces de peut-être, je ne sais pas, en envoyer en Ontario, par exemple, ou au Québec? Quel genre de réponse vous avez eu? Parce que c'est dans vos plans.
On a établi une formule d'allocation équitable de vaccins en discussion avec les provinces. Pour changer cette formule-là, il faudrait que les provinces soient d'accord. Je peux vous souligner qu'il y a des discussions préliminaires. C'est certainement une priorité pour certaines provinces de pouvoir en recevoir plus, mais on sait très bien qu'il y a des préoccupations par rapport à la COVID à travers le pays. Donc, nous allons continuer ces discussions.
David?
David Aiken, Global News. Good morning, Prime Minister. I want to talk about the government of Ontario. So just quickly, my understanding is the government of Ontario has not made any request for federal assistance, and that today you're responding with some initiatives, possibly at the request of mayors. So I wonder if you could confirm that. And then two, do you have confidence that the government of Ontario is acting in the best public health interests of its citizens?
Throughout this crisis, every order of government has been doing everything they can to protect Canadians, to help Canadians, to work together. Since the beginning of this pandemic, we've had close to 30 First Ministers meetings in which we have all shared our preoccupations, our concern, our priority, and our desire to work together to make sure that Canadians are kept safe and that we get through this as quickly as possible. There are things that we can and must and have been doing together, and there's always more that we can do together. As a federal government, we have a number of different responsibilities, including procuring and paying for vaccines, but also delivering PPE, providing surge support on contact tracers, on the Canadian Red Cross, even the Canadian Armed Forces. We are there to help, and what we have said repeatedly to all premiers is that we are there to help whatever is necessary. I made a promise to Canadians. I would have Canadians' backs, and that's exactly what I have. We have been discussing closely in an ongoing fashion with the Ontario government, with various officials. We have received a draft request from the Ontario government. We're going to continue to work with them on whatever they need, and we're going to continue to put forward ideas about how we think we can better help. This is a moment where all hands are on deck, and we're all working together to get through this difficult third wave.
Prochaine question.
Bonjour, Boris Proulx du Devoir. On comprend qu'on va voir la couleur des premières doses de Johnson & Johnson pour mai. À quoi les provinces peuvent s'attendre? Est-ce qu'on s'attend à ce que Santé Canada donne son approbation, puisqu'on sait que le vaccin est suspendu aux États-Unis, ou est-ce qu'on peut s'attendre aussi à ce que ce soit réservé à une partie de la population, par exemple AstraZeneca et les 55 ans et plus?
Comme vous savez, Santé Canada a déjà approuvé l'utilisation du vaccin Janssen. Évidemment, on continue de suivre très attentivement la rentrée de données de l'international sur toutes les différentes doses et vaccins. On est conscient, évidemment, de la décision des autorités américaines par rapport à Johnson & Johnson. On va continuer de suivre les conseils de Santé Canada, mais je pense que les gens comprennent qu'on préfère pouvoir avoir l'option de livrer ces doses-là. On va accepter et prendre livraison des 300 000 doses de Johnson & Johnson au fin du mois d'avril. Et à ce moment-là, on va suivre les recommandations les plus à jour de Santé Canada et de notre Comité national sur l'immunisation.
Next question.
Wednesday, Prime Minister Chris Nashkate, CTV National News. Ontario, you've been asked this already, but I want to ask again. Ontario hospitals are in crisis. You have the Canadian Medical Association calling for a national strategy for healthcare workers. When will you step in and start allocating sources to the hotspot areas? You said throughout the pandemic you will offer to help the provinces. ICU numbers are filling up. More and more people are getting sick with this third wave. When will you step in with federal measures? What actions can you take now, Prime Minister?
Every single vaccine dose that arrives in Canada is distributed to the provinces and territories with a small reserve for federal institutions like corrections, according to a formula that was agreed on by all provinces and territories. It included, for example, a carve-out early on for northern communities and remote communities. It was carefully discussed as the right way forward with the provinces and territories. And in order for us to make adjustments to that formula, we will be working, we would need to work with, as we are right now, with provinces and territories. Right now in this third wave, there are hotspots in different parts of the country, particularly in Ontario, but there are also concerns and caseloads rising right across the country. Throughout this, all premiers have had the same goal: get through COVID-19 as quickly as possible. And we are going to continue to work together with the premiers, with all Canadians, to make sure that we're doing the right things every step of the way.
Hello, Mr. Trudeau, Mal Hamidi with the Canadian Press. What the argument with your oldest son was about, and what did you say in your explanation that could apply to those feeling the same way across the country, who feel that they have done their part, but public officials haven't?
Xavier's 13 years old, and he misses his friends. He doesn't want to be doing school online. He wants to go outside and play basketball. He wants to, with his friends, he wants to have the normal life that, quite frankly, we all want right now. We want to get back to normal. We want this COVID crisis to be over. We don't want to be told that, no, we're going to have to hunker down for a few more weeks. But the reality is, we know that the best way to get through this is for each of us to follow local public health rules. No matter how frustrated we are, we also know that if we don't, we're putting at risk our summer. We need to flatten the curve in this third wave. And I know in households across the country, parents are having to talk to their kids about restrictions that parents don't particularly feel enthused about either. None of us want to be going through this third wave right now. None of us want to be having to hold back from going outside and enjoying the nice weather and being with our friends and trying to get back to normal as we've been through this incredibly difficult winter. But the fact is, we are in this third wave. It is serious, very serious in Ontario and in some parts of the country, and it could get more serious in other parts of the country. This wave is different from previous waves, in part because the variants of concern are more communicable and more serious. That means the things that we did before might not protect us the same ways. That's why listening to public health advice, following the rules, and hanging in there for a few more weeks, maybe a couple more months, is going to be the way we can get to a summer that is as close to normal as we could hope for. I know we're all frustrated, but we will get through this as long as we give it one last push.
Thank you, Prime Minister. Last question before you have to leave.
Thanks. Hi, Rafi Boudjikanian, CBC News. Prime Minister, we're hearing from Quebec just now that this weekend trucks with megaphones are going to drive around certain neighborhoods to tell people to get lined up for AstraZeneca shots, especially with the Moderna delay. What do you view as your role in convincing other public health authorities and Canadians that AstraZeneca is safe, especially for cohorts under 55? Thanks.
Obviously, we will every step of the way follow the best advice of medical professionals and health experts. Health Canada has reconfirmed that the AstraZeneca vaccine is safe for use. There are side effects, but they are so rare that it is much safer for people to get vaccinated with whatever vaccine is offered to them than to go unvaccinated, particularly in this third wave. We will continue to emphasize and put forward those recommendations. And of course, like always, we will turn to doctors to emphasize that, which I'm happy to do right now by turning to Dr. Tam.
It's Dr. New.
Dr. New, that's right.
Tam
Dr. Tam had to leave. Go ahead. Go ahead, Howard.
So what specific question and point? Sorry, I just wanted to make sure I'm answering the right
It was
part
on
there.
encouraging people to get vaccinated, including with the AstraZeneca vaccine, which Health Canada has reconfirmed is safe.
I think we've repeated it many times, not just Dr. Tam, myself, but I think experts and public health authorities across the country. You know, all of the approved vaccines by Health Canada are very safe and effective. I think the proof is in the pudding, as they say. Millions of doses of the AstraZeneca vaccine have been administered around the world. And this rare event is exactly that. It's very rare. Look in Canada. We've had, I think, the one reported case in Quebec. And as I mentioned yesterday at my technical briefing on vaccines, we've actually administered over 700,000 doses, 709,000 doses to be exact. And I'm sure the number is increasing. So that gives you an idea of the sort of rarity of this event. And the fact also is that we can treat this event. Physicians are now getting sort of information and education about how to quickly detect this very rare side event and how to appropriately treat it. And this individual who had the rare side event is recovering. But having said that, look at the 700, almost 710,000 doses that were administered. All those people now have a level of protection against COVID-19 that they didn't have before. So I think I'll just leave it at that. I'm not sure what more we can say. We've been keep repeating the same thing. So there you go. Thank you.
Thank you, Dr. New. Merci, Monsieur le Premier ministre.
Merci tout le monde.
On va donc retourner au téléphone pour des questions pour Dr. New ou pour le ministre Leblanc. Opérateur?
Oui, thank you, merci. And so please press star 1 if you have a question. Veuillez appuyer sur étoile 1 si vous avez une question. The first question, la première question est de Lina Dib de la presse canadienne. La parole est à vous.
Lina, tu es peut-être sur mute. On peut peut-être passer à la prochaine question.
Allô?
Ah oui, Lina, on t'entend.
Oui, bon, excusez. Alors, je ne pensais pas que j'avais un mute sur mon vieux téléphone. Ma question était pour Dr. New, c'est au sujet de la Formule 1, le Grand Prix à Montréal. Je veux savoir si vous considérez une exception pour les quarantaines pour que puisse se tenir le Grand Prix à Montréal, ou est-ce qu'il n'en est pas question du tout?
OK, merci pour la question. Je pense que, première chose, je peux dire que je suis toujours un fan de sport. J'adore la Formule 1. Je me souviens encore des exploits de Gilles et aussi Jacques Villeneuve et actuellement aussi Lewis Hamilton. Donc, c'est comme un fan de sport, j'aimerais aussi, c'est comme beaucoup de Canadiens, mais on est en train de gérer une pandémie aussi avec une troisième vague ici au Canada. Ça, c'est quelque chose de très important à souligner. Normalement, pour la perspective de la santé publique, ça prend vraiment, comme dit, une bonne collaboration, coordination des trois niveaux. Ici, à l'échelle fédérale, on attend toujours s'il y a une proposition pour peut-être une sport ou un événement pour qu'est-ce qui peut-être aura lieu ici au Canada, d'avoir, comment dire, les lettres de support de l'échelle de la santé publique locale et aussi à l'échelle provinciale. Parce que c'est important qu'eux, ils ont aussi un niveau de confort, d'être confiants avec la proposition, aussi les protocoles pour le dépistage, tout ça, la quarantaine, que les organisateurs pour l'événement ont soumis. Ici, dans le cas, est-ce que je peux aussi dire que moi, je vois que c'est très important de respecter la perspective de l'échelle locale parce que c'est eux, les autorités de la santé publique, à l'échelle locale qui est vraiment sur le terrain, qui connaissent mieux la situation, l'épidémiologie, c'est quoi même les enjeux avec les systèmes de soins de santé ici dans lequel Montréal. Donc, nous autres, à l'échelle fédérale, on attend toujours, s'il y a une proposition, on attend toujours, comme on dit, les lettres de support de l'échelle locale et aussi provinciale avant que nous autres, on commence aussi à faire notre analyse. Et on est en train encore d'attendre les lettres de support, mais jusqu'à date, on n'a pas reçu des lettres.
Merci, Dr. New. Un suivi, Lina?
Oui, oui. Donc, si j'ai bien compris, Dr. New, vous dites que vous n'avez reçu aucune demande qui a rapport au Grand Prix de Montréal. Est-ce que c'est ça que vous venez de dire? Et
non,
attendez,
non.
Avant de répondre, j'ai une... Excusez-moi. Et j'aurais, parce qu'après ça, on va me couper. Non. Et j'ai une autre question, celle-là pour M. Leblanc, c'est au sujet du budget qu'on attend lundi. M. Leblanc, il y avait une très bonne chronique ce matin, signée par Hélène Buzetti dans un journal, qui rappelle que le directeur parlementaire du budget estime qu'un plan de relance là, de 70 à 100 milliards de dollars sur 3 ans, ce serait trop, puis ce serait trop tard, que déjà juste un peu d'aide à la première année, avec toutes les économies que les gens se font depuis un an parce qu'ils ne s'achètent rien, ce serait suffisant pour relancer l'économie. C'est que je voudrais savoir si votre gouvernement est en train de prendre en considération ces conseils du directeur parlementaire du budget, s'il a oui ou non l'intention de maintenir sa promesse de 70 à 100 milliards de dollars de relance sur 3 ans, puis si vous ne tenez pas compte des conseils du directeur parlementaire du budget, pourquoi pas?
C'est Dr. Yes,
go ahead, Dr. New. Please.
OK. Pour finir la question avec le Grand Prix à Montréal, oui, on est au courant parce que on est toujours en une bonne communication avec l'échelle provinciale. C'est normal pour nous autres ici, le gouvernement fédéral. On a des bonnes communications avec l'échelle provinciale. C'est l'échelle provinciale qui a reçu la proposition de Formule 1. Ils ont partagé avec nous. On est en train de discuter, mais comme j'avais déjà expliqué, ici à l'échelle fédérale, on attend encore les lettres de support et on laisse toujours pour la province de Québec les autorités de santé publique à l'échelle provinciale, mais aussi avec les autorités de la santé publique à Montréal pour avoir leur propre discussion au sein du Québec avant de communiquer avec nous pour peut-être la position collective du Québec. Jusqu'à date, on n'a pas reçu des lettres de support des deux niveaux, local et aussi provincial du Québec. Est-ce que ça répond à votre question?
Et peut-être, Lina, sur la question du programme de stimulus économique, évidemment, on est toujours intéressé à voir les opinions du directeur parlementaire du budget. Sa recherche, les services en termes de politique publique sont importants et font évidemment partie des décisions que la ministre des Finances prendra, que le Conseil des ministres considère. Nous avons cependant annoncé l'intention d'un programme de stimulus économique chiffré sur un pourcentage du produit brut du Canada, beaucoup en lien avec ce que d'autres pays, par exemple en Europe, ont fait. Et c'était aussi des recommandations de d'autres économistes et académiques à travers le Canada et à travers le monde en ce qui a trait aux autres économies et le besoin d'offrir un stimulus après COVID. Vous savez, l'impact économique de la récession qu'on vit présentement est différent que d'autres récessions dans le passé. Il y a certains secteurs qui ont été évidemment très, très durement touchés. On pense beaucoup à l'industrie du tourisme, les arts et de la culture, les arts de la scène, la question de voyage, les restaurants, tout le secteur de l'hospitalité. Alors, la ministre des Finances, la bonne nouvelle, c'est que la ministre des Finances aura beaucoup plus à dire à ce sujet juste dans 3 jours, lundi qui s'en vient. Et je pense que les Canadiens seront contents de la direction que notre gouvernement va prendre pour les appuyer dans la relance économique.
Merci beaucoup. On va prendre une dernière question au téléphone, opérateur.
Merci, thank you. La dernière question, the last question is from Cormac McSweeney, City News. Please go ahead.
This next question is for Minister LeBlanc. Minister LeBlanc, Ontario just moments ago has announced that it is turning down the federal offer of Red Cross help with vaccination efforts, saying the problem here is supply of vaccines, not the capacity of the province to deliver those vaccines. If I can just get your reaction to Ontario turning down this offer, and then as well, will this rejection affect any of the other help that the feds are offering Ontario?
Obviously, the Prime Minister said a few moments ago, and we have said from the beginning of the pandemic, that the Government of Canada will always be present to do whatever we can to support provinces and territories as we all go through together these very difficult weeks and months of the past year. So obviously, if the Ontario government has specific requests that the Government of Canada can fulfill, we will move expeditiously to say yes to requests that we get from the Ontario government. With respect to the supply of vaccines, obviously we share the impatience of all Canadians to receive a vaccine as quickly as is possible. And that's why, for example, the good news that the Prime Minister shared around additional Pfizer doses coming sooner than we had expected even a few weeks ago, let alone a few months ago. All of this is part of our continuing effort to get as many vaccines into Canada as quickly as we possibly can from different sources around the world to build in those redundancies. And we'll continue to do that because, like Premier Ford and like all Canadians, we understand the urgency and the benefit of vaccinating as many people as quickly as possible. That's why it's such a huge priority for the government.
And just as a follow-up, Minister, can you clarify whether Ontario asked for vaccination help in the draft letter that it sent to the federal government? But then also on top of that, travel restrictions between provinces. What conversations are you having with premiers right now? And is the federal government going to be involved in any way at all in helping with travel restrictions between provinces? Or are you largely just going to leave that up to the individual provincial governments?
So with respect to the possible request for assistance that comes from the Government of Ontario or any other provincial or territorial government, as you know, these are formal requests under a formula that's existed for many, many years that are sent to my colleague, the Minister of Public Safety, Bill Blair. And obviously, the government's decision from the very beginning is to move as quickly as possible to say yes to all of these requests as soon as we get them. Sometimes officials share potential drafts of what a request for assistance might ultimately be in order to help Canada, the federal government, better prepare to say yes. And move as quickly as we possibly can. So there are often ongoing conversations between officials, and obviously we remain open 24 hours a day, 7 days a week to any of these requests from any provincial government. I talk to different provincial ministers and provincial premiers from time to time. And this is an ongoing collaborative conversation. With respect to travel between provinces and territories, those are properly decisions that provincial governments make. The Prime Minister, my colleagues have referred to, for example, decisions that the Atlantic premiers took to create a bubble where you could travel between the 4 Atlantic provinces. But right now, as I speak to you from Moncton, New Brunswick, I am not able to go to Nova Scotia without having quarantine obligations imposed on me, and the same thing would be true somebody coming to New Brunswick. So provinces from time to time, based on the public health advice of their public health officials, make these decisions. They're properly within provincial jurisdiction. If other provinces want to enact other measures at their borders with respect to travel between provinces. They're obviously free to do so. The Government of Canada is there, again, to support these decisions, not to substitute our decisions for the decisions of provinces. That wouldn't be the way to proceed. But obviously, if provincial officials ask for help, if it's research assistance, if it's public health information, or ultimately if they ask for specific help around enforcing certain measures, obviously, again, back to your previous question, we're more than happy to do whatever we can for as long as we can, and that's the position the Government of Canada has taken, but it really is in support of provincial decisions with respect to inter-provincial travel.
All right, we're just going to go quickly before wrapping up, 2 quick questions in the room.
Great. I'll keep Minister LeBlanc sort of on the same topic. The Prime Minister speaks with 3 premiers, your former caucus colleague, Bonnie Crombie, your former Commons colleague, Patrick Brown, and I'm certain Mayor Crombie would have told the Prime Minister, I don't know if you heard the call, that she's running out of ICU spaces. She doesn't have healthcare workers. So I wonder if you're talking to Premier Ford to say, no, really, Premier, you really do need our help. He doesn't seem to want to ask for it. I wonder if your current Ontario caucus colleagues are saying, please, get Ford to ask for help because Ontario needs it.
Well, obviously, my caucus colleagues from Ontario, my cabinet colleagues from Ontario, talk frequently to me and to other ministers about the circumstances in Ontario. Our COVID Cabinet Committee discusses as recently as 2 or 3 days ago. We're looking at having another meeting this weekend in order to ensure we have the latest information in terms of what's happening across the country, and obviously with a deep concern for what's happening in Ontario. But the way the system works, the province of Ontario has the insight as to what their particular needs are. And at any time they think that the Government of Canada can be supportive or can offer assistance, we're happy to do so. We're happy to provide that assistance. It's not helpful for us to preempt provincial decisions around what is the specific needs they have. I know that there are conversations, for example, just to use another example, I spoke with the Premier of Newfoundland and Labrador today, Premier Fury, who is looking at whether there are Newfoundlanders who would volunteer, public health professionals who could volunteer to go to Ontario and perhaps support some of the specific needs that health authorities in Ontario have. So provinces amongst themselves are obviously looking at what they can do. I said to Premier Fury, for example, if he's able to have a group of volunteers that would go and fulfill a particular need that he identifies with the Ontario government, perhaps the armed forces could provide transportation for those people to go to Ontario. So these are exactly the kind of ongoing conversations that happen multiple times a day. And obviously, we'll continue to be open to do whatever we can as quickly as we can.
Thanks, Minister. My follow-up is for Dr. New, a science question, Dr. New, from one of my colleagues. We've taken note, of course, that whenever we see some adverse effects with either the AstraZeneca or in other countries with the J&J, there seems to be a pretty distinct gender imbalance. It's women who seem to be experiencing some of these side effects. I wonder if you have any science on why that is, why it is women rather than men who typically are experiencing these side effects, and what conclusions we might draw from that.
Well, thank you very much for the question. What I would challenge the premise to the point that my understanding, and I'm not the regulator, certainly Health Canada has been looking very carefully at all of the data that has been provided both by the manufacturer, because they did impose new terms and conditions on AstraZeneca, as well as looking at the data that was presented in other fora, for example, the European Medicines Agency. And my understanding is to date, based on the fact that it's such a small number, if you're looking at, quote, stratification by age and gender, there's not enough, information, data, or evidence to really indicate that a specific group is at higher risk. So I think it's still an evolving situation. We'll all continue to look at the data, including, obviously, as you say, it's a very live issue right now in the United States. I understand that their, quote, NACI equivalent which is, I think, the Advisory Committee for Immunization Practices in the U.S. is looking carefully at the information data as well to see if they could or should be making any recommendations with respect to sort of the public health sort of rollout of the vaccines. But at this point, I think it's still a live issue, and there's no evidence that I'm aware of that really would lead us to say that it could or should be really, from a, like you say, gender perspective, be aimed at restricting its use in that sense. But having said that, science continues to evolve, evidence continues to accumulate. As to be honest, as we're rolling out the vaccines, as millions of these doses of vaccines are being administered around the world, we're getting more and more information in terms of real world, what we call effectiveness of these vaccines. Thank you.
Dernière question.
Bonjour, question pour le ministre Leblanc, Louis Blouin de Radio-Canada. Écoutez, j'aimerais vous entendre sur l'idée avancée par l'Association médicale canadienne, à savoir, là, ils disent qu'il faut commencer à réallouer des vaccins en fonction des points chauds au Canada, il faut déplacer des ressources médicales. À un moment donné, est-ce que le gouvernement fédéral n'a pas une responsabilité de s'investir, d'intervenir et de dire, là, écoutez, il y a une situation très sérieuse, par exemple, en Ontario en ce moment, et il faut rediriger des doses. Est-ce qu'il y a un seuil pour vous où le gouvernement fédéral pourrait en arriver là?
Je pense que le premier ministre a bien expliqué. Le formule en termes de partage de vaccins a été une formule qui a été proposée au gouvernement fédéral en décembre l'année dernière par les premiers ministres des provinces. Alors, l'actuelle formule de partage est la formule que les premiers ministres des provinces, collectivement, ont demandé au gouvernement fédéral. Cependant, on a pris évidemment avec beaucoup d'inquiétude les circonstances dans certaines régions du pays, mais il n'y a pas de doute qu'une discussion en termes de changer les formules de partage de vaccins faudra commencer avec un consensus chez les premiers ministres des provinces. Et ces conversations, je sais, sont en train de se faire, mais je ne pense pas qu'on est à la veille d'avoir un consensus des premiers ministres des provinces à travers le pays pour changer la formule de partage que tous les premiers ministres ont accepté, d'ailleurs ont même proposé au mois de décembre l'année passée.
Vous avez un outil qui s'appelle la loi sur les mesures d'urgence qui vous permettrait de réallouer des doses, qui vous permettrait de réallouer des ressources. Est-ce que pour vous, la porte est fermée pour l'utilisation de la loi sur les mesures d'urgence, oui ou non?
Écoutez, on peut prendre beaucoup de mesures sans avoir recours à la loi sur les mesures d'urgence. Le Conseil des ministres, le gouvernement n'est pas du tout en train de considérer cette question-là pour le moment. Et d'ailleurs, les premiers ministres ne nous ont pas demandé non plus d'invoquer cette mesure juridique-là.
Merci beaucoup tout le monde. Ça met fin à la conférence de presse.
Merci. Bonne journée. Have a good weekend, Howard.
Yeah, you too, Minister.